A lot of headlines from today's news conference, but probably the most important one just might be that those numbers we heard early on, more than 100,000 deaths, well, they may be way off.
We have to thank the American people for continuing to follow our guidelines on slowing the spread.
Today, President Trump spoke of a glimmer of hope on this of all days when New York broke its own record for the number of people who died of the coronavirus in one day.
We're looking to have far fewer deaths than originally thought, and I think we're heading in that direction, but it's too early to talk about it.
This morning, CDC Director Robert Redfield said it looks like the original predictions that between 100 and 240,000 Americans will die from the virus will prove to be way off.
Even those models that were done, they assumed that only about 50% of the American public would pay attention to the recommendations. In fact, what we're seeing is a large majority of the American public are taking the social distancing recommendations to heart. And I think that's the direct consequence why you're seeing the numbers are going to be much, 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 much lower than would have been predicted by the models.
But the actual fatalities also carry with them an alarming finding, that a disproportionate of those who die from the virus are African American.
We've known literally forever that diseases like diabetes, hypertension, obesity, and asthma are disproportionately afflicting the minority populations, particularly the African Americans. Unfortunately, when you look at the predisposing conditions that lead to a bad outcome with coronavirus, the things that get people into ICUs, that require intubation and often lead to death, they are just those very comorbidities that are unfortunately disproportionately prevalent in the African American population. So we're very concerned about that. It's very sad. It's nothing we can do about it right now except to try and give them the best possible care to avoid those complications.
At the news conference today, President Trump was asked about a dire warning sent to the White House in late January and February by his trade advisor, Peter Navarro, in a memo which stated, according to the New York Times, that the lack of immune protection or an existing cure or vaccine would leave Americans defenseless in the case of a full-blown coronavirus outbreak on U.S. soil. This lack of protection elevates the risk of the coronavirus evolving into a full-blown pandemic, imperiling the lives of millions of Americans. During the same time frame the memo was sent, President Trump was publicly sending a different message.
If you go back 6 months or 3 months ago, nobody would have ever predicted. But let's see, I think it's going to be under control.
Today, the president said he never saw the Navarro memo, but that around the same time he shut down entry into the United States for people coming from China.
I heard he wrote some memos talking about pandemic. I didn't see him, I didn't look for him either. But that was about the same time as I felt that we should do it. That was about the same time that I closed it down.
Another topic at the news conference today, the resignation of Acting Navy Secretary Thomas Modly after his apology for making disparaging remarks about USS Roosevelt Captain Brett Crozier. Modly was heckled by the ship's crew as he told them he fired the popular captain for writing a letter about the coronavirus spreading on the ship.
He was A, too naive or too stupid to be the commanding officer of a ship like this.
Well, I had no role in it. I've heard, I don't know him, but I've heard he was a very good man. And the whole thing was a very unfortunate. The captain should not have written a letter. He didn't have to be Ernest Hemingway. He made a mistake, but he had a bad day. And I hate seeing bad things happen.
The president was also critical of the World Health Organization, saying it favors China and didn't do enough to raise alarm about the pandemic.
We're going to put a hold on money spent to the WHO. We're going to put a very powerful hold on it, and we're going to see. It's a great thing if it works, but when they call every shot wrong, that's no good.
Is it time to freeze funding to the WHO during a pandemic?
No, maybe not. I mean, I'm not saying I'm going to do it, but we're going to look at it.
You did say that.
We give a tremendous, no, I didn't. I said we're going to look at it. We're going to investigate it. We're going to look at it. But we will look at ending funding.
If the president does put what he calls a powerful hold on the World Health Organization, that is a big deal. In fact, the United States is the biggest funder for that organization. Now, we just heard the president say he was going to, and then we heard him say he was not going to. So we just have no idea what he really actually meant by all of that. Let's go back to you.
Okay, Randy, thank you. And back